This is part of the phlebotomy portion of the practical exam. For this video, I will be talking about some of the venipuncture methods. We have three venipuncture methods. We have the syringe method, the vacuum tube method, as well as the butterfly method. And for this video specifically, I'll kind of just be touching on the syringe and the vacuum tube method since they kind of go hand in hand. So first you want to make sure that you have all your supplies ready to go. You will need a syringe. So today I have a nice pen as my syringe. You'll want to make sure that you have the evacuated tubes if it's for the vacuum tube method. You'll also want to make sure you have a tourniquet, you have disposable gloves, an antiseptic wipe, as well as gauze. You can also have a paper towel laid out or some sterile cloth to make sure that you can have somewhere to set your needle and your gauze and all of your other equipment. And then you also need your biohazard sharps container and an adhesive bandage to apply to the patient after the procedure. So first what you're going to want to do is you'll sanitize your hands and perform hand hygiene. You'll greet the patient and you'll confirm their full name and date of birth. And then you'll also want to confirm with the patient that they have complied with any special physician orders, like if they needed to fast or something like that. So if they have done so, then you are ready to assemble your equipment. And then after you have done that, then you can assess the patient's veins. So what you'll want to do is you'll want to ask the patient which is their non-dominant hand, so you can start looking for veins on that arm typically. So today, since I'm right-handed, I'm going to go ahead and be attempting to show you on my left arm. So you can go ahead and palpate the veins. The preferred site is the antecubital space right here, and right here in the center is the #1 vein of choice, which is the median cubital. And then you also have alternate veins, which are the cephalic on the thumb side and the basilic on the pinky side right here. So what you'll want to do is you can apply a tourniquet, so that way the veins are more easily able to pop out. And you want to apply the tourniquet about 2 to 3 inches above the site of choice. So I would apply the tourniquet right about here in this area. And you would want to also go ahead and ask the patient to kind of clench their fist like this a few times to really help those veins to pop out. So when you apply the tourniquet, you want to make sure that you never leave it on for longer than a minute. And what you'll do is you'll pull the tourniquet underneath the forearm of the patient if your site of choice is the median cubital, and then you will hold it with one hand. You'll twist the top and you will kind of tuck, it's hard to do by myself, but you'll kind of tuck one of these underneath like this, and you want to make sure that both of the flaps right here are facing up away from the site of puncture. So once you do that, that's it for your tourniquet. And then you are ready to make sure that you found the vein. You can map it out as well. And then you can go ahead and remove the tourniquet. You can then perform hand hygiene and apply gloves. And then you'll want to clean the area of the venipuncture site. So you'll take your alcohol wipe and you will start in the center and you will just work your way outward in circular motions about 2 inches away from the puncture site. And then once you have done that, you are going to apply the tourniquet again the same way. And we'll say I applied my tourniquet already. Now I am ready to perform the venipuncture. So I have my syringe here, and what you're going to want to do to pop the cap off, you can see you're going to want to use your thumb, and with one hand you're just going to pop that cap right off, if you can see. So when you're inserting the needle, do this in an area you can see, you want to make sure that you're at a 15-degree angle, and as soon as you lose sight of the lumen, you're going to insert the needle further into the vein. If you can see, I've just pretended that I inserted it. Okay, so say it's still there. So my needle is still here, and I'm going to aspirate. Once I've done that and I have a good steady flow of blood, then I can go ahead and release the tourniquet. And once I have filled the tubes with whatever tests were ordered, then I'm ready to extract the needle. So what you want to do is you want to make sure that you extract the needle at the exact same angle that you inserted it, in the exact same way. And you want to make sure that you're doing it quickly as well, but not harshly. So you remove the needle, and as soon as you start to remove that needle, you would apply gauze and pressure to the puncture site. And you can also ask the patient to apply pressure to the site as well. So that way you can dispose of your needle and any other materials, and you can also get the specimens ready to go to be sent to the lab. So we'll look at my site, and let's say that the wound has properly been clotted. Then I'm going to go ahead and apply an adhesive bandage, or you can just leave the gauze and wrap tape around the gauze. And that is it for the venipuncture procedure. After you're done with the patient, you would make sure that you document everything in the patient's medical record, as well as sending the labs off properly sending the specimens off properly to the lab based on the procedures of your office. So that is it for the venipuncture.